All right, welcome to the bone lecture, relevant bone lecture for our drawing practice of what we need for relevant artistic anatomy. And so I'm going to introduce just the pelvic unit here and also the femur here, two wonderful bones that obviously go together and attach together. So just remember that this is anatomy for artists, for those who are using artists for drawing and or painting in their practice. I am not a medical doctor, and this is not for that reason. So we want to look at these objects for form. Now, we have the pelvis. We can separate them, and we'll connect them together. So we have the pelvis here. Now, the pelvic unit, if you look at it, reminds you of a bowl, reminds me of a bowl or a cradle. It cradles something in its inside. It kind of holds it together, and that's kind of how I feel like about holding some of the inside structures of our softer organs and tissues. And it can be thought of when drawing as a kind of a cylinder or a bowl with a bottom to it. Okay, and it has an aspect that tilts a little bit more downward as well when I put it just in simple profile. So it's kind of a slight cylinder in a bowl orientation, kind of process. It really feels like it could contain and hold water. Now it does have, when we study some of the muscles, even though these don't really come out that much in drawing, there's a floor, an abdominal or a pelvic floor, so you really could kind of hold water, through there. The next form I think of when I draw and think about the pelvis, when I draw the model, is it as a box in a kind of a tilted, shaved, slightly at about 20 degrees, box. So if we put a straight line against here, this spatial distance is about 15, 20, maybe 30 degrees, but roughly somewhere in between there. The point of it is it's a downward turn. That's important to know. And this tends to be right here by the end of the crest here, of the iliac crest and here of the ilium, where I draw the side of generally my box. I try to be flexible with it. So this is a side, this is a top plane, a front plane, and through here obviously a bottom, and then of course this becomes a large back of the shaved down box as well. A couple things to notice is when we look at these, this part of the pelvis, the ilium, the ilia here, okay, they tend to remind me of kind of like wings, like a bat. They're flying, so this could be the head of a bat. So they're winged out, right? If we look at them from the side view, this looks like a wing, a side wing here, okay? And then from our back view, it tends to be, if a bat was flying away, you can make your own sounds if you want, and this would be the head up and through here. The next aspect of the pelvis is that they are wider as they move outward. So this is wider in through here. So they're not straight up. That's important to know as you draw them. And as you look for these iliac crests in drawing on the model, these are going to show up prominently here and around through here, okay? That's where the obliques will attach onto, the rectus abdominis to the pubic tubercle in through there, the symphysis through here, the cartilage through here, and then also in the back, the erector spinae against here, right? And sheathing over and close to the gluteus maximus will sheath across, and the gluteus medius will be over here as well. So there's a lot of activity going on besides much more activity than we'll even need to study as artists. So keep in mind I'm talking to you and demonstrating to you as an artist, not as a medical doctor. So if there are any doctors that are out there that are artists, hopefully they'll understand, and we can greatly simplify what we need to get out of it. Let's talk about some of the parts. Let's go back to the front. And we have some parts here. We have the sacrum in the back aspect of the the pelvis. We've seen this before. We know how curved it is. Look how curved downward into that ball. And if we come across the side, we can see this. This really helps give you the feel of that buttock form, the glute, the maximus, gluteus maximus, and medius, and also the fat deposits of the buttock halves will give you this curved kind of aspect. So I talk about the buttocks, or my students know this here at the university. I tell them that your butt is a butterfly, and that kind of goes along with these wings. It sounds better than a bat, but maybe that could be remembered too. Your butt's a bat, or your butt's a butterfly, meaning that these are wings, and the glutes attach and run across them, and they sheathe across, and they become their own form, two bean-like or wing-like forms, and this would be the butterfly body, and the head and the antenna would be up here. So these are very much separate. The hip bones themselves, these parts, see where these pins are, they actually detach as well. So there are actually two forms attached to the sacrum. The sacrum, in general terms, I believe is talked about more of the spine than it would be on the hip bones. But since they come together and create this beautiful cradling that we see from the top, this bowl-like form, I like to include it, and you can see a lumbar cut out right in through here. And then it also takes on the curve of the sacral coccygeal curve that we see in our four beautiful curves of our spine. So those are the ilium on the sides here. This is the iliac crest in through here, and that shows it predominantly in drawing. And then right back here in the back end, these two areas will point out as dimple points on the model, and the skin will attach here. This will show up because there's so much material upon neuroses, thoracobular fascia atop of these as the erector spinae come down and the lat come down, that they'll smooth out a little bit, but it's still fairly thin, and so you can still feel this. You won't have spinous processes generally coming out, but this will be a triangle. I'll call it the lower back triangle, and you can see that on the model, where roughly the coccyx ends is where the split of the gluteals will be, or commonly known as our butt crack. Obviously, we just, that is what it is, right? All right, so we have that. Now, coming down lower from the ilium, now they're attached. The hip bones are just two, so all this is attached. This is the ischium. A lot of times I'll say it as the ilium, but what I really mean is the ischium here in through here, or you could say ischium. I prefer ischium, okay? Those were our attachments. They'll have a strong ligament coming through here that the biceps femoris in the back of the legs will attach to down through here. So this is the ischium. As we turn it through, you'll notice that this hole in through here is where nerves and arteries come through, and that is called the foramen of the pelvis. We have two of those, and they come all the way, as you can see, all the way through here. Now, the circular concoction in through here, this little element, is called the accipitabulum, and it is the area where the femur ball connects into. So the acetabulum in through here, and I always mispronounce that, it's also just the hip joint. So as it locks into that socket, it is a crater-like object, so you can feel it very, very circular in through. It's almost a half dome in through there, and has a very deep protrusion, about an inch or so down through there. There's a ligament that comes out and that attaches to the ball or the head of the trochanter that we'll get to in a moment. Notice that it is on top of, a little bit to the bottom of the ischium and a little bit behind the foramen. Now, its aspect, as we look at it kind of straight on, tend to point somewhat forward and downward through here, and they take on kind of the same diagonal as the ischium do, coming out of the pubic bone intersynthesis in through here. So both of them protrude outward and outward here in this way. They loop back around and under, and you can see them in the top view. See how they bowl under here, and they generally make a kind of an ear connection that looks like the ilium on top, or these kind of ears as well. You can think of it as wings or ears as well. And again, you get this sense of this bowl opening in through here. It's really deep. Our hand can go through there. It's like a mouth, and it's a very deep kind of structure as it goes in. When you draw these, generally, unless you're drawing it for a dynamic, detailed study, you'll always consider and conceive of it generally as a bowl or a box form. Much easier. So you want to get this form down in memory, and then when you need the finite details, you can draw it on its own, and that's what we're trying to do here. But for the most part, we want to see those simple relationships. This part's going to be very important, as it's going to show on many models. It's the part where the obliques end, the buttock begin, and the trochanter, as it comes out, will be what we call the hip point, or your thigh bone will come out in through here as well, very, very deep. Of course, the buttock will sheathe across in through here. So those are the parts of the pelvis. We have the sacrum, we have the ilium here, the iliac crests, the ischium here, the acetabulum in through here, and then the foramen, these holes coming through, and then the pubic bone, the symphysis, and I just call this the kind of the pubic crest, as it comes down to give you that nice bowl kind of form. So let's talk about now the femur a little bit and see how they connect. So we have the femur bone. Now the femur is this top bone here, okay? And I just have it attached back onto the tibia and the fibula patella, because I want you to see that. The attachment now of the femur into the socket, the ball socket joint of the pelvis, or the hip bone, is pretty obvious now, and so we get a nice range of motion, right, coming down. And of course, that can be overextended. We know that would be detrimental. Maybe if you were a yoga master, you could do something like that. But you see how that rolls in. That's going to be important for that range of motion in through here. And so we'll see that this can come in a little bit. It can come out a little bit because of the adductors on the inside of the pelvis, around the pelvic bone, to the medial side of the femur in through here. So we have that nice socket. Now, between here, there is cartilage between the head of the trochanter. It's a very circular kind of bone sitting right on inside there. So there's cartilage inside. There's a ligament that attaches here to the head of the bone that sits on in there. And this is sheathed quite a bit all over through ligament material coming through and kind of wrapping around. You won't see that when we draw, but it's good to know. So let's take a look further at the femur. We'll set our beautiful pelvis to the side. So the femur is a tubercle type of bone, or a tube, or a cylinder. It's the longest bone of its kind in the body. It's a very substantial, kind of heavy bone. Okay, so we'll get to know it pretty well. So I'll turn it around to the back side in through here and kind of move around. So there's some things you want to know, mistakes that artists make when they draw, and we'll talk about these now. So let me come around here. The femur is a bone that is not straight. Look how it's also raised. This is a flat table with brown paper, butcher paper, to show a little contrast here. Notice how that I can pass nicely my pen all the way, this little pointer, all the way through. Even watch this. Look how far I can attach have my hand go underneath to about my knuckle, right into it. Then it gets a little tighter. So if we show it to the side, take a look at that difference. That's pretty dramatic difference. So it's not straight. Look at the curve. Most all of our bones, to my knowledge, are sheathed and turned and torqued, so muscles can attach to help us with moving and twisting and torquing and turning. So we're very dynamic that way. So we never want to draw bones that are straight up and down, that are truly vertical either. They're always sheathing and they're moving. So also the bone, it's a tube in its most general sense, right? So it's very much a round kind of cylinder, but it is a little flatter on its backside, and I'll talk about that in just a little bit. Now, as we go up, we'll identify some parts here. Turn it to the side. So we've already seen one. That's the ball of the femur in through here. So it's a 3/4 inch ball, and then it's sheathed off and shaved off a little bit. We can kind of see that further. See it around there. It almost reminds me of a ball socket for a trailer for a truck. Same kind of idea. Then the next part is the neck. So we have the neck in through here. Then we have the trochanter. So this bulbous head, it's a good side of it from the back, you'll see quite a bit, is the trochanter. Now, when we see this on the model, we'll see how they connect. See how they connect up? Like so. There's a downward aspect to the trochanter. It's not just straight across, unless we're lifting the leg up. Then we'll get gathering of the glutes and fat tissue, and this will start to bulge into the iliac crest and also the obliques and the lat a little bit. But there's a downward aspect to that. That's important to know. So, head, neck, trochanter. We'll get it from a side view here. We can see how that bulges out nicely. Okay? And then, of course, now front view. We'll have a front view here as well. Okay, so it bulges in, connects into that. We have a curve here. Curve into here. Another thing that we have, another curve we have a little bit, is that this bone tends to also curve in. I'll let it stay off. Curve in this way as we draw it. So we're having a curve, a gentle curve that comes this way and sweeps this way, just a little bit of a curvature as we draw. It's a lovely little line. The abductor muscles coming from the pelvic unit and attaching onto the femur in through here. So we have a bone that's raised up, and part of that reason why, if we start to turn it now to the back, we have the head, the neck, the trochanter. We have the lesser trochanter right in through here. We have some forms attaching, muscles attaching. Then we have this little aspect. It might be a little hard to see in the camera. This is called the raw line, or linea aspera, I believe. And it's where the glutes, part of the glutes will attach to the maximus part. Gluteus maximus will attach to, and other forms through here. And it tends to form a V. So there's a long line here. You can see that it's very raised up. It's very pointy as it comes off a little bit. You want to take a look, I'll roll it around. So that's where it gets a little bit less cylindrical. Then it moves up into a kind of V shape, and then it starts to get shaved off here a little bit into the back. And then we're going to get to, I'll turn it back over, then we're going to get to the condyles. Now the condyles are, we have a medial condyle and a lateral condyle. I call them the knuckles, kind of like your fingers there. These large knuckle forms. These are very active in movement and ligaments that attach, and also tendons that help connect muscle to bone. So very active place where all the muscles, the quads and the hamstring or the back leg muscles attach and around and up to both of these. Of course, we also have the patella. So the condyles are very box-like. I'm going to turn this slowly so you can see that. You can see their aspect. It's almost like a golf club, okay, coming together. And they tend to knuckle out in the back too as well, where the calf muscles, the gastrocnemius, will actually come up and attach to, like little finger muscles come up and attach to here. But the condyles are very box-like, so when we draw them later, we can conceive of them as these very boxy forms that sort of curve over a little bit. So those are the forms of the femur and the pelvis. And of course also we get the patella. This is patellar ligament adherent attaching to the tibia and the fibula, and we'll discuss those later as we get to the lower leg, right? So again, you want to think of them as a nice unit together. So as we talk about the pelvis, in the upper part of the lower extremities, right? We can take now a better aspect measure of all this together and see the pelvis and the femur working hand in hand to bring dynamic movement to the body. All right, so there we go. Now we'll go on and take a look at drawing these wonderful objects and how we can simplify them. Okay, let's go on to that.